Good afternoon, everyone. Welcome to the Tuesday COVID-19 situation report. We will be featuring the latest statistics on the local COVID situation. My name is Brittany Cadence. I'm the Communications Manager for Peterborough Public Health. I'm very pleased to have you with us today. We are grateful to have several of our elected officials with us who hopefully are able to share some remarks. And then Dr. Salvatierra will walk us through some slides and provide some other important updates in this ever-changing situation. So as we gather on this interesting day, I've even seen tornado warnings, so be careful out there. But it is a chance to find ourselves grateful for this beautiful place we call home. So with that, I would like to respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So joining us today from Selwyn Township is our board chair, Mayor Andy Mitchell, and I will invite him to share some opening remarks. Please go ahead, Andy.
Thanks, Brittany. When it comes to vaccines, the residents of Peterborough are being asked to be patient once again. During the winter, we waited 6 weeks after vaccines first arrived in Toronto before the first doses arrived in our community, and the process of inoculating residents in our long-term residences began. Now, as shipments of Pfizer to the province are being increased, the amount of vaccines coming to our area will be temporarily reduced for the next week or two. This is being done to divert as much vaccine as possible to hotspots and to stop the alarming increases in places like Toronto and Peel. However, we anticipate this reduction to be short-lived as Pfizer allocations into Ontario are expected to double, bringing local supplies back to previous levels. This same impact is being felt by many other rural communities across the province. I have to be honest, I have mixed emotions about this process. On the one hand, I understand the importance of directing a limited resource to where it is needed the most. We all want the hotspots controlled, and the evidence suggests this approach will achieve that. I am proud of what we have accomplished locally in controlling the pandemic, appreciative of the men and women who work in public health and other frontline healthcare positions, and am eternally grateful to the Peterborough region's residents for the sacrifices they have made to keep themselves, their families, and the community safe. On the other hand, I know how important getting our residents the vaccine is. Yes, we can endure a short-term decrease in supply, but it needs to be just that, a short-term disruption. As additional supplies arrive in the province in mid-May, I will be looking to the government to be directing ever-increasing amounts to our community. Peterborough and Peterboroughians have always done their part. This emergency is no different. To everyone, thank you. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, so following that update, we'll now walk through our current statistics, and I'll ask Dr. Salvatierra to share these with us. Please go ahead, Dr. Salvatierra.
Thank you, Brittany. So we'll begin with the current case count, and as of 4:30 p.m. yesterday, we had 76 active cases. This is 26 fewer than we reported on Friday. Most of these continue to be variants of concern. The number of high-risk contacts has dropped by 73 individuals and now stands at 247. Next slide, please. This bar graph is showing a positive trend in our weekly cases. It's showing a decline. Last week, there were 65 new cases reported, and we are starting the week off so far with only 4 new cases. And so that's also very hopeful, and we hope that these weekly decreases continue. Next slide. Here you can see that that the 304 new cases have been reported so far this month in April. April will be the month with the highest number of new cases for Peterborough, and it certainly shows the impact that the third wave has had on our community. Next slide, please. We've got the demographics here. So you'll see that it's 50-50, males and females, pretty evenly split. But that in the terms of the age bands, if we add the under 20s and the 20 to 29 together, we can see that more than half of our cases, or about 600, are in individuals who are 29 years of age or less. We'll focus on exposures in the next slide. And here we continue to see that that percentage of our community spread is increasing despite our best efforts to identify and isolate both cases and contacts. The cases that report no known contacts is creeping up. It was 17.5% last week. It's now 18.7% this week. And this underscores the need to follow the stay-at-home order and to go out only for essential purposes, as there is community transmission of COVID occurring. Next slide, please. As far as testing goes, you'll see that more than 49,550 of our local community members have been tested at least once. This is 750 more than the previous week. So we continue to see high weekly testing rates continue in our community. Next slide, please. So the number of our outbreaks in our community is actually now 5, and this dashboard will be updated at the end of day today. We had an additional workplace outbreak declared late in the day yesterday. This workplace has voluntarily closed, and all cases and high-risk contacts have been identified and are isolating. One workplace outbreak was declared over last week, and the remaining ones remain stable. So there's no question that we are at a pivotal moment in the course of this third wave and in our pandemic response as a whole. We have a better handle on where the virus is spreading rapidly, and there are several tools in our quiver that we can use to bring it under control. The Ontario Science Table has produced some useful modeling to inform a more strategic approach over the next few weeks. This slide is from the Science Table, and it shows the potential impact of vaccinating 3 million people in 30 days in 4 different ways. The gray bar shown here is the status quo. That's what'll happen if we continue down the same road. The orange, yellow, and green bars show what could be accomplished in 3 different goals. The first is in the percentage of hospitalizations averted. The middle shows the percentage of ICU admissions averted. And the third on the right is the percentage of deaths averted. By directing more vaccine to the 114 designated hotspots. What you see here before you is that by directing 50% of vaccine allocations, that's in the yellow bar here, or to those hotspots in the next 3 weeks, we could avert 23 to 25,000 cases, mostly in young adults where the transmission is occurring. And we could prevent a significant number of hospitalization, ICU admissions, and deaths. You'll see here on this graph about 45%. This is the rationale for why we must take a Team Ontario approach to focus those vaccinations where they are needed most. And it will mean that some eligible people in Peterborough will need to wait a little longer for their vaccine while we do this. Our board chair has articulated this very well, but we need to do this. And we need to also stay at home and to continue adhering to public health measures so that we can get through this critical surge. At around the same time that the stay-at-home order is scheduled to be lifted, our vaccine supply is set to double, and we will see wait times shrink and access open up. We have opened up a few more appointments in the first 2 weeks of May for those who are currently eligible. Perhaps not as many as we would have liked, but I am supporting the temporary reduction of vaccines to places like Peterborough because it's what makes most sense. And I would encourage everyone who is over 60 years of age who has not been immunized to visit the online booking site to book an appointment. For special education teachers and for pregnant individuals, please call our local call center to book your appointments. Today, the province has also announced that workers in licensed childcare centers will also become eligible for vaccination starting Thursday. A letter will be coming from employers with directions on how to book your appointment. So we must remain focused on preventing the spread of the virus by curtailing our social behavior. And to illustrate this, we've prepared another graphic that shows just how important this is, especially with the variants of concern circulating in our community. So you'll have to imagine this is a flip chart. And here you'll see a recent local workplace outbreak. It's designated under that green umbrella there, the greenhouse. That's a personal service setting that was impacted here recently. And we are showing you the related exposures that took place over a 2.5-week period from late March to mid-April. So under this green workplace outbreak, you can see one individual colored red. That is the index case who brought the infection into the workplace. We believe this is because they were the first to become symptomatic. Now, this workplace, this individual had 2 household members, none of whom became cases, but did report, and you'll see there a little house with 3 individuals, did report attending a family gathering where others may have transmitted the infection to this person. The index case worked while infectious, leading to both staff and clients becoming positive cases and high-risk contacts. So you can see here that there were 7 new cases in total in the dark blue related to this workplace exposure. And you can see that there were 16 high-risk contacts identified in the light blue. Thanks to the strong record keeping in this workplace, our team here at Peterborough Public Health was able to quickly identify all of the cases and contacts and to instruct them to self-isolate and to be tested. The yellow houses represent all of the personal residences, and you can see that the majority of individuals self-isolated and did not spread the virus any further. You'll see that one case worked in another workplace there, where there were 3 high-risk contacts, and that's represented in that little red house on the right. There were 3 high-risk contacts there, and they all self-isolated, and they did not spread the virus any further. In the next slide, we're going to look a little closer. And if you look at the one household at the top right there, you can see that one case in our workplace exposed the other 2 members of that household, and they both became cases. Now, one of those cases went to work. So you can see that in the red, represented by the red house there. They went to work and they exposed others. One person became a case and they went on to socialize with others in their household, of whom one also became a case as well. So you can see one more workplace, one more household being impacted. Now we're going to take a closer look at the left-hand side of this graphic at the one individual there in red who was a high-risk contact who became a case. This individual infected their household contact, you will see there, but they also went out to dinner in a restaurant and they were seated with others at the time that they were contagious but did not have symptoms. Fortunately, 2 of the diners did not become cases, but you can see that one did become a case and exposed their household members. There were 4, fortunately, who all didn't become cases, but they all had to self-isolate for 14 days. One of the other diners who was extremely lucky, did not become a case, but you can see lived in a household where there was a case. And so this person was exposed not only at home, but also by dining with our workplace case that was asymptomatic at the time. So this example that took place here in Peterborough shows how shows 2 things really. It shows how common exposures are in the community. But it also emphasizes how important the public health measures are in order to protect both ourselves and others. It shows that you can go on to put the people that you live and socialize with at risk if you don't limit your interactions. Workplaces, restaurants, households, anywhere that people gather and socialize are all ways that the virus can spread between us. So I'll end with that. Thank you very much, and back over to you, Brittany.
Thank you very much, Dr. Salvatierra. Okay, so now we will invite our elected officials to share any remarks, and I see we have MP Miriam Monsef, Warden Jones, and Mayor Therrien. So let's start with MP Monsef, who's been able to join us, and I'm happy to put you up on screen if your camera's working there, Miriam.
Thank you so much, Brittany. Yes, please. Can you hear me?
Yes, go right ahead.
Perfect. Hello, colleagues. Bonjour, Anin. Salam alaikum. I'm in my basement on Mississauga and Anishinaabe territory, and so grateful for the community-wide effort over the weekend and for the ongoing work of you, Dr. Salvatierra, Chair Mitchell, the entire board and the team at Public Health, and all our frontline healthcare workers. I have an quick update on additional supports from the Government of Canada for Ontario vaccines, and look forward to answering any questions that may come up. Yesterday, the Government of Canada approved Ontario's request for military assistance to help manage the rising strain on the province's healthcare system. In response to this request, the federal government's prepared to deploy federal health human resources, provide support from the Canadian Armed Forces, and fund the redeployment of the Canadian Red Cross to augment or relieve staff within medical care facilities. The Canadian Armed Forces were already preparing to deploy up to 3 multi-purpose medical assistance teams. These are scalable healthcare provider teams primarily composed of nursing officers and medical technicians, as well as additional armed forces personnel for general duty support as needed. Work is currently underway to complete the on-the-ground assessments, which will determine the number of armed forces personnel that will be deployed to Ontario. And earlier this morning, the Royal Canadian Air Force transported healthcare workers from Newfoundland and Labrador to Toronto and remains on standby to do so from other jurisdictions as well. I want to thank Dr. Fury, Premier Fury, and his wife, also a doctor, for stepping up and for their support for their neighbors in Ontario. On vaccines, as of yesterday, 14,444,052 doses of vaccines were shipped to provinces and territories. 12,307,785 doses have been administered, with 2,136,267 doses not yet administered. Here in Ontario, 83.8% of vaccine doses have been administered, with over 84,000 yet to be. The first dose population coverage here in Ontario is now at 29.4%. Over 2 million doses of Pfizer vaccines are going to be coming into Canada weekly. The first J&J shipment will arrive in Canada later this week. And I want to thank everybody getting vaccines into arms and those who are talking to their friends and neighbors and loved ones about why vaccines are important. We know what we have to do. We also know that our actions over the coming weeks will determine the kind of summer we'll have and how quickly we get to conquer COVID. Of course, vaccines are an important solution, and get the first one that is available to you that is the right vaccine for you. But our most effective defense against this virus is following science and public health advice. You saw Dr. Salvatierra's analysis and those really helpful charts and numbers. It just takes one person and one occasion to create tragedies and hardship for a community and for several families. So take care of yourselves. Thank you for doing your part to conquer COVID. Better days are ahead.
Thank you very much, MP Monsef. And we are trying to find hope through all of this for sure. So thank you for that message. Okay, joining us from the county, we have County Warden Jones. If you have some comments, please go right ahead, Warden Jones.
Okay, thank you very much. I hope you can hear me okay. No, I don't have a whole lot to say. I think the biggest thing that's on my mind right now, and that's a shout out that I want to make to Chief Scott Gilbert over that spectacle that happened in Peterborough this past weekend. I was absolutely so impressed with the way he and his fellow officers responded with so much class. And I know it's in the city and all that kind of thing, but this kind of behavior reflects very much on the county as well. People from outside the area, quite frankly, don't distinguish between city and county. We maybe understand that, but they don't. The word Peterborough gets mentioned, and we all take the good and the bad. And I truly hope we don't pay the price with any additional virus infections because of that ridiculous display on the weekend. So to Scott Gilbert, I just want to say Peterborough County is patting you and all your officers on the back. I was very, very proud that you handled it that way. And we've got to get everyone to stop reacting like this. My goodness, I know I say it all the time, we're in this together, and we are, but it's sure getting hard to understand that when you see this kind of numbers of people show up with all these conspiracy theories that make no sense to everybody. These are people's lives we're talking about. We're all inconvenienced. We all want to get back to normal. There's nothing special about you. So let's buckle down and do what we're supposed to do. That's my rant for today. And I thank you and Rosanna and all your team Thank you. Keep doing what you're doing. We appreciate it. Thanks.
Thank you so much, Mayor Warden. Okay, let's hear from Mayor Diane Therrien, who's joining us today. Please go ahead, Mayor Therrien.
Hi, Brittany. Thank you. I'm still laughing. Thank you, Warden, for those comments. Well said. It seems like just yesterday that we were starting this pandemic and we all thought, it'll be over in a couple months, and here we are. So I know that we're all, frustrated and everybody's tired, and we see that play out in so many ways. But we do need to come together as a community. We need to support the small businesses who have been hurt by the pandemic, and they're being harmed again every weekend by the protests that are blocking roads. And preventing customers from being able to pick up curbside pickup, and keeping people from wanting to come downtown because these thugs want to gather and endanger other people. And they say that they're doing it because of small business, but they're having the opposite effect. And so, as the warden said, thanks to Chief Gilbert and his team for handling that the way they did this weekend. I know it wasn't easy. I know everybody's on edge right now, and don't worry, I won't cuss on this press conference, but I will say that we need to keep pushing. People need paid sick days now. We've seen it get voted down again by the provincial government, and I will keep saying that because that's one of the clearest and easiest ways to help keep the control and the spread of the disease and the variants of concerns under control while the vaccines are rolling out. Paid sick days now. That's all I have to say for today. Thank you.
Thank you so much, Mayor Therrien. And yes, we're very fortunate to have Chief Gilbert with us today on the line. So as we move into the opportunity for questions, I'll now invite our media guests to ask them of either Dr. Salvaterra or Chief Gilbert. And let's start today with our friends from Global. How about Jessica Niznik? If you've got some questions, please go ahead.
I do. Thanks, Brittany. Threw me off there. I'm not last today. My questions will be for Dr. Salvaterra. And
okay.
I have a few for myself, and then I have a few for Mark. So, Dr. Salvaterra, maybe we've talked about this before. Young people are, have high numbers of COVID, but people tend to think it's, because they're socializing, and maybe they are. But can you also reiterate the fact that, you've said before, a lot of them have multiple jobs, and that's just the age group that they're in, 2 or 3 jobs, and they don't have those sick days like the mayor was talking about. Can you explain maybe again why this age group is so prominent?
Well, there's a couple of reasons. I think you hit the nail on the head with the first one. Many of these young people are precariously employed or are working in jobs without any benefits. And so there is a financial barrier for them to stay home when they need to stay home. And we have lots of examples of people who went to work while they were waiting for test results when they shouldn't have. They should have stayed home, and also who continued to work even while sick because they could mask their symptoms. They could take a Tylenol. They would try to stay as far as away from others as they could, but they just couldn't afford to stay home. And so they took the infection into the workplace. So that's definitely something that we know needs to be addressed, and we don't believe that we'll be able to control this pandemic until we allow and support people to stay home while they are awaiting testing and when they need to self-isolate, either because they're a high-risk contact or because they're a case. But the second phenomenon that we have found is that many of these individuals, because of the high cost of housing and because of the limited availability of housing, many of them share their accommodations with many others. They share washrooms, they share tight spaces, there's crowding that exists, and it's very difficult for them to even self-isolate when they are at home. So we've seen lots of transmission occurring to household contacts, and household contacts are probably the leading risk factor for the acquisition of this infection. So I think both need to be addressed. We need to make it easy for these people to stay home when they're sick. And in some cases, we probably need to support them with better places to self-isolate.
Great, thanks for that. So I understand that the vaccine's being allocated to where it's needed most, but we're really falling behind then. And I'm trying to reference this chart on phase 2 that came a while ago, which doesn't seem to have much substance anymore. By the end of April, we're supposed to be at over 70, starting into 65. How far behind do you think we're going to fall with this shortage? Where do you think that we could be at by the end of May or April, or sorry, April or May?
Right. So I believe that with the vaccine allocations that have been shared with us for the end of May, at least the last 2 weeks of May, if they come through, because they are a doubling of our allocations, we can expect to see that the 60 and over population, we should be complete by the end of May. So that's about a 4-week behind schedule. I mean, I would have loved to have them all done by the end of this week, but I'm pretty confident we'll have them all done by the end of May. In addition, we have to recognize that we are also at the moment immunizing the highest risk and high risk patients with chronic diseases. The hospital has begun that group, and that will continue throughout May. Again, we may have had them done sooner. They'll be spread out over the month. We are also immunizing the special education teachers. They should be done by the end of May. We should also see the pregnant individuals done by the end of May. And I believe we will also be able to say that the home care patients, including the ones who are housebound, they too will be completed by the end of May. So good progress, maybe not as fast as we would have hoped for, but really good rationale for why this is going to take us a little bit longer to do.
Okay, and the last question for me before I move on to Mark. We keep opening, it up to more eligible age groups. Do you think that's wise? Should we not maybe just finish what we've started and get those guys done? Like the old senior population was supposed to go first. Now we've introduced all kinds of people. Is it wise to just keep opening it up?
Well, I think what you're seeing is the impact of the third wave and the variants of concern. They're just so much more transmissible. In the old days, when we were dealing with just, plain COVID, it made more sense to take an age-based approach and just keep going down the ages, because age is such an important risk factor. But with the variants of concern, we now see some settings where there is transmission occurring. And so we have an obligation, and we see younger people ending up in the ICU because the older people are protected. So I do think we have an obligation to respond to emerging evidence, to the epidemiology of this outbreak, and where we can, be strategic. And I think that's what you're seeing. You're seeing the strategic redirection of vaccine to address groups where we see higher risk of transmission, hospitalization, ICU, and death.
Great, thanks, Dr. Salvatore. I apologize for taking up so much time. Here we are, on to Mark.
Okay.
It's been a month since the outbreak was lifted at Severn Court. Do we have a better idea of just how big this outbreak got in terms of community spread? Originally, we thought it was hundreds of cases. So do we have an idea?
We do and we don't, in that much of the community, we do follow cases and contacts. There were secondary and tertiary transmissions that occurred linked to that outbreak in the community, where we saw other students, other households, other close contacts being impacted and becoming cases. We don't link it for our purposes. We don't necessarily link it to the outbreak because we have a very defined definition of the outbreak, and we only count the cases that live in that setting or are somehow attached to that setting. Once you get beyond the setting, we don't continue that link. We could potentially do that kind of an analysis, and if we had more time, and maybe someday we can add up all of the cases that were linked, but right now we just don't have the resources to do that.
Okay, that's it for me. Thank you very much, Dr. Salvatierra.
You're
and
welcome.
Thanks everyone for your patience.
Thanks so much, Jessica. So Greg Davis is also joining us from Global. Did you have any questions for our speakers today, Greg?
Just one question, Dr. Salvatierra. Regarding the new variant in India, what do we know about it, and do the current vaccines provide protection for it?
So we're calling it a variant of interest right now because it's still too early to assess whether this variant is more transmissible or more deadly. It was identified about a month ago in India, and at this time it has already spread to over 20 other countries. So it certainly has traveled a long way in the first month. We continue to monitor it, to assess it for both transmissibility, severity of illness, and vaccine escape to see, do people who are immunized, are they more likely to get this particular variant? So we'll have more of those answers for you over the coming weeks, I believe. But we already know that 4 provinces have detected the variant, and we continue to screen and look for it here in Ontario as well.
Okay, perfect. Thank you.
Okay, great. Thanks so much, Greg. Okay, let's hear from some of our radio colleagues. We'll start with Matt Latour. So if you've got questions for our speakers, go right ahead, Matt.
Yeah, I've got a couple questions for Dr. Salvatierra. The first has to do with the Johnson & Johnson vaccine. I know MP Monsef mentioned that we're expecting to receive our first shipment in the country later on this week. Do you know if any are scheduled to come to Peterborough?
I'm keeping my fingers crossed, Matt, but I'm not certain. We have been told that the allotment for Ontario will be coming potentially the first week of May, but that it may not go to all public health units in the province. It may be used in certain areas and potential hot spots. Because it's a 1-dose vaccine, it would be ideal for settings like shelters or correctional facilities. It's also the perfect vaccine for migrant farm workers who are coming to work in Ontario. And the timing is ideal for that as well, given that these farm workers are arriving at the airport at Pearson International and could be immunized there, are being immunized there. It could be with the Janssen product, which would mean that they're good to go once they complete their quarantine. So I keep hoping that we will get some here in Peterborough, but I certainly don't know yet.
And my second question had to do with, I saw pregnant people in Ontario are now eligible to get the vaccine as well. Is this something that I assume you're taking with welcome news, considering we've talked about this in the past? And are you happy to see that this group has maybe moved up a bit?
Yes, in that there is emerging evidence during this third wave with the variant to show that more pregnant women, pregnant individuals are ending up in the ICU needing respiratory assistance. And so I'm glad to see that the province is moving so quickly on that evidence. They were identified in the at-risk group, which we have not been able to immunize yet, but they were bumped up last Friday to highest risk. And as of yesterday morning here in Peterborough, we have had appointments available for them as early as next week. So I'm hoping that pregnant individuals will take advantage of this opportunity and get their vaccine as soon as possible.
That's it for me. Thank you.
Okay.
Thank you very much, Matt. Okay, Graham Elliott, did you have any additional questions from Freak and Oldies Radio?
Oh, that was me logged in on Graham's
account. That's you earlier. Okay, so
Mine.
okay. So then let's move on to Trent Radio. I think I see Rob is here today. Any questions today, Rob?
Hi, thanks, Brittany. Nothing from me right now, thanks.
Okay, great. Then let's hear from Danelda Fraser from the Havelock Rail, joining us from Havelock. Do you have any questions for our speakers today, Danelda?
Not today, thanks. A lot of it has been covered, thanks.
Okay, great. Okay, let's then hear from our examiner colleague. So Joelle Kovac from the Peterborough Examiner, if you've got some questions, please go ahead.
Okay, I'll start with Dr. Salvatierra. Doctor, could you please tell us why the health unit is not identifying the closed workplace? I know you've explained this before, but could you please say again?
Sure, and the reason for that, Joelle, is that because we have identified all of the cases and the high-risk contacts. It's a small workplace. It doesn't really interact with the public in the way a retail setting would. We feel pretty confident that we have identified everyone who needs to self-isolate, so there isn't any reason to have any kind of public notification or call out to others who might potentially have been exposed. We think we've got that covered.
Okay, thank you for explaining that. Is the shortage of vaccine going to mean any canceled clinics this week or not?
No, in fact, we have been able to, given the, I would say it's a relative shortage rather than an absolute shortage. And that's because even though we've heard from MP Monsef that we are getting more Pfizer vaccine, it's being redirected to the hot spots. So places like Peterborough are not able to take advantage of that increase yet. So we are staying with our current allocations. We are not seeing an increase until May 17th. That's when we are expecting that our allocations will double. Now, given what we have, because we have been, the province has been able to confirm for us what the next shipments are, we've now been able to make available more clinics. We had these clinics on hold. They were more tentative until we knew for sure that we had vaccine, because what we don't want to do is schedule a clinic and then have to cancel it. So we had these in the shadows, and we have brought them out as of yesterday. We've made more appointments available. So at least 3 more were added to the Evinrude at the Evinrude Center. So that's why we are asking people that if you are still waiting for a vaccine and you haven't got an appointment yet, now's the time to go online or to go to our local call center if you're pregnant or if you're a special ed teacher and get your appointments.
Mm-hmm. Okay. As you explained previously, the pharmacy supplies is a separate thing, and you don't necessarily know what their allocations are.
Well, I was advised this morning by the province that the AstraZeneca supply for pharmacies will be depleted in the next few days, which is great in that there's been good uptake of the vaccine, but this month's shipment was canceled by the manufacturer. And so the province and the federal government are still looking to see where they can get more AstraZeneca and how soon. In the meantime, the province is looking at whether or not pharmacies can help deliver other vaccines while they're waiting for more AstraZeneca. So I believe we'll hear something in the next few days about what we might anticipate seeing at pharmacies.
Oh, that's interesting. Okay, thank you. I have a question if the police chief is still on the line. Looks like he is. I wondered if there have been any further charges since the protest, Chief.
I'm going to defer that question, Joelle, to Inspector Lyons, who's on the phone.
Okay.
Or who's on the John can update us on where we're at. I can tell you that a number of other people have been identified, and that from pictures that were published, we've heard from other jurisdictions like Coburg, etc. People from there attended that protest on Saturday. So the potential to make it a super spreader even increases when you understand that it's not just people from our own community that are attending. You got Bernier and Hillier, obviously, that aren't from our community, but there was others from other areas of the province that attended, including Oshawa and other areas that we know of. But I'll leave it up to John Lyons to give you the details.
Thank you.
Thank you, Chief. Yeah, just regarding that, Joelle. So there was the initial 8 tickets that were issued on the weekend on Saturday. 3 were directly related to the breach of the COVID legislation. 5 were traffic-related tickets that were in relation to an out-of-town vehicle, excuse me, that had come with a group of people and caused some issues at the protest going the wrong way on George Street. And then, as a result of the follow-up from the amount of people that were there, it's been an ongoing effort to identify people that were involved. There are further charges pending. We are now in the process, as the chief referred to, of identifying these individuals, some of whom are local, some of whom are from definitely out of jurisdiction. It just adds another level of complication for us to deal with, but it is doable, and we are going to follow up, and we'll make sure that those that have been identified will be dealt with accordingly.
Okay. To make sure that I understand that you and the chief both spoke of people from other jurisdictions, are other police forces involved with the investigation therefore? Like, are they looking at the photos and trying to identify people?
Yeah, Joelle, whatever means is necessary for us to do that. Yeah, we'll definitely be trying to identify these individuals by whatever means we have available to us.
Hmm. And did you just say there were 8 charges on Saturday?
Yes, that's correct. There was 8 charges related on Saturday.
Hmm.
And some of those charges weren't, Inspector Lyons mentioned that they were traffic related, but there was other charges for urinating in that park. Because as you know, there's no washrooms in Confederation Park and nothing close by where anybody could use a facility, but people were leaving themselves in public view.
Okay, thank you for adding that. That's an important. I'm dismayed to hear this. Okay. Is the mayor still on the line?
I think so.
Yes, I am.
Okay, it was mentioned last night by Councillor Clark that there is a bylaw against allowing the use of the square for this purpose. Did you want to talk about that? I know
so my
that
understanding is that the cenotaph and the wall of honor part, there's a permit for that. So when we have the Remembrance Day ceremony, for example, when they set up on there, but the green sort of park-ish space around is a bit of a separate piece from that. Now I can follow up with the clerk's office for clarification, unless Brendan on the line knows the specifics of that. But that's my understanding, is that the actual wall of honor and the cenotaph proper need a permit, but you are allowed to gather in just the park area. And the problem, the disrespect that was shown, well, I mean, there was many layers of disrespect that was shown, but the main problem about the permit has to do with when people are climbing up onto the cenotaph.
Yes, okay. Okay.
And Brendan has his hand up, so he might be able to provide some additional information.
Okay.
Thank you, Mayor Therrien. The use of Confederation Square would require a permit for exclusive use of the park. The city is currently not issuing permits for use of the park under the current Reopening Ontario Act regulations that prohibit these gatherings. The Citizens War Memorial area or precinct is subject to the Cenotaph Committee, which has representation from veterans organizations as well as City Council to approve the use of that space for events. Thank you.
Okay. All right. Thank you very much. I'll pass it on to my other colleagues.
Okay, thank you very much, Joelle. Okay, so also joining us from the Examiner, I see Reg Watson. Did you have any additional questions today, Reg?
Will there be any Ministry of Labor blitz for Peterborough in coming days?
I wonder if that's a question for Dr. Salvaterra for now.
Yes, that I could answer, but my answer is just that we don't have anything planned right now with the Ministry of Labor. Of course, they have advised us that they are increasing their numbers of inspections that would be done at random of workplaces. So I don't know if they are planning to come into the Peterborough area or not. But definitely there is a priority right now with ensuring that those workplaces that are open are complying with all of the public health measures.
And has the Peterborough Public Health laid any specific charges lately against workplaces not complying?
I don't know if Julie is on the call this afternoon.
I don't think she is today, Dr. Salvaterra.
So we'll have to get back to you on that one.
Okay, thank you. That's all.
Okay, all right. Thank you so much, Reg. All right, so last but absolutely not least, we have Paul Rellinger with us from Kawartha Now. So if you've got some questions for our speakers, go right ahead, Paul.
I do, Brittany. Thanks so much. For Dr. Salvaterra, and I also had a question for Mayor Therrien and Chief Gilbert. If I could start with Dr. Salvaterra, you were explaining earlier about the 29 and under group and some of the factors. One thing that really hasn't been said, and I don't know how much of a factor it is, are we seeing those higher numbers in that group? And well, we're seeing higher numbers in that group, but also lower numbers in the older group. And I'm just wondering how much of that you attribute to the fact that that group has received the vaccine.
Yeah, it's a good thought, and Paul, and I hope that we might start to see some analysis of impact of immunization on cases. But you will recall that that group, that age group, the under 29s, has been our highest category for cases right almost since the start. So it's nothing new. And we see how that it continues, and yes, I hope that at one point they will all be immunized, and we'll see that start to go down. But in the meantime, until we have enough vaccine for everyone, and we're not there yet, we only have our public health measures to rely upon. So that makes the need for paid sick leave. And by sick leave, I mean the ability to stay home if you've been tested and you're waiting for results, or if you're self-isolating because you're a high-risk contact and you've been told to stay home by us, or because you're sick. I mean, that becomes a very important means to keep people home and to stop the transmission that is occurring in this age group who continue to work when they are ill.
Okay, thank you. And I'm sure this is more difficult to do than I'm suggesting, so I apologize. But when we look at the factors for that 29 and under group, and you touched on some of them, would it not make sense to change the priority of the vaccine to that group quicker?
Well, up until now, I mean, the priorities for vaccination is based really on mostly on where who's at highest risk for severe illness. And so that's why we have been prioritizing on the older population, because up until now, they have been the ones ending up in ICUs and dying. I think as more vaccine becomes available, and we're seeing that already, we can start to focus on transmission. Where is the highest rate of transmission? But you cannot immunize yourself out of this third wave. I mean, immunizations alone are not going to stop what's happening now. They can help, but in addition, we need the public health measures to keep people at home so that they don't spread the virus.
Great. Thank you, Dr. Salvatierra. If I could, for Mayor Therrien, just a clarification. I thought that a couple of media briefings ago, you had indicated that the only place in Peterborough that you didn't need a permit was Confederation Park. And I think what I heard today from Brendan was that you do need a permit. So I'm just trying to clarify that.
Yeah, no, and I appreciate that. And I think I got that wrong. So I appreciate Brendan clarifying. But I mean, right now the city isn't issuing permits for any parks anywhere in the city. But Brendan knows better than I do, so maybe he can provide that clarification for you.
Thank you, Mayor Therrien. Yes, the exclusive use of that park would require a permit, and also for the use of the cenotaph area, the cenotaph committee does review applications for the use of that, and the cenotaph committee includes representation from veterans associations. Thank you.
Oh, okay, thank you. And again, back to you, Mayor Therrien, if I could. If a group is gathering in a park that has no permit or hasn't been issued a permit, can they not just be evicted from the park?
Yeah, so I mean, that can happen for sure. There's some groups, you know, like that use the park, that use Confederation Park on Monday nights to feed people. So I think it sort of would depend. That might be something that the police would be better able to answer. But if folks don't have a permit and are having a kind of a demonstration and it's in contravention of the bylaw, then certainly they can be evicted from the park.
Okay, great, thank you. And if I could, over to Chief Gilbert, please. Chief Gilbert, you just heard the mayor's response to that question. I'm just wondering, again, no permit. Obviously, it's not a lawful assembly in that sense. And what can the police do, if anything?
Well, we can lay charges, but as you've seen from the size of the crowds and the crowd dynamic, things can change rapidly. And that was quite ably demonstrated on Saturday by Randy Hillier, changing the rhetoric in his speech and heavily criticizing the police after all the previous speakers had praised the police there. And Hillier turned the crowd very quickly, and then you're trying to take enforcement action, and you can see how easily or how quickly things can ramp up. For us, it's a matter of numbers. There's more of them than there is of us, and we have time on our side. As you've heard from Inspector Lyons, we'll follow through and we'll lay the appropriate charges after the event. It's preferable after the event. Sometimes that can't always happen, as what occurred on Saturday. But as to clearing 600 people out from a park, that's not going to happen, quite honestly, because it couldn't be done safely at this point. People are bringing kids and families there, and you know, unfortunately, we're also seeing a different demographic being attracted to some of these rallies that weren't present in the beginning when these protests started. And you know, there is the potential for violence to occur at these parties or at these protests. And we're starting to see a number of people that are showing up for other than reasons of trying to be there to support small business. Mm-hmm. You know, I can't put it any plainer than that, other than I think if you Google Randy Hillier and look at some of the groups that he's been giving speeches to, you can see what what is starting to be attracted to some of these rallies, and that's quite honestly very concerning to me. When you hear his comments down in Kingston, and the inference that COVID restrictions are worse than the Holocaust. Come on, Randy. That was over 6 million people that were exterminated, and you're linking it to the Holocaust. So you can imagine the type of people that were concerned are going to start attending some of these rallies. And if they do, there's the huge potential for violence there.
And your answer makes perfect sense, Chief. I just wanted to hear it from you. Just another thing, Warden Jones at the top of the briefing gave credit to your department, and I just thought it'd be prudent to hear from the chief about your thoughts on your officers' patience and tolerance, professionalism. In the face of some pretty trying times on the weekend.
Well, I'm very proud of our police service and the personnel that we had there, our auxiliary volunteers, our special constables, and our police constables and supervisors that were there. They all did an excellent job. It's very difficult to put yourself in a situation where people are lecturing you on their Second Amendment rights, which is a U.S. term, when people are, telling you you're violating their Charter of Rights, but they haven't read Section 1 of the Charter that allows the government to put restrictions in place for important purposes, or they talk about the Bill of Rights, but they haven't read the preamble to the Bill of Rights. So it's difficult to stand there and listen to some of what the invective that we're being subjected to, and then to hear Randy Hillier, make his comments that were without foundation, but trying to rile up the crowd, particularly after he'd phoned the police service on the Friday to have a chat about the demo and what his concerns were. So it's kind of interesting to hear how he portrayed that on Saturday.
Absolutely. Chief, are you aware, and excuse my ignorance on this if it's not the case, is there another protest planned that you know of coming up this weekend? Or?
Well, they say they're going to be back every weekend to protest. It just depends on who's going to show up. And as always, we'll be ready. We were expecting larger numbers this past Saturday because of some of the comments that had been made by Randy Hillier and others that were planning on attending, and other people from out of town planning on attending. So unfortunately, we did inconvenience members of our own community, but we had to put in place some road closures to control traffic coming into that area. As you know, George Street with the Atria construction, we're down to one lane. The previous weekend, there had been several near collisions because people were going out on the road to wave flags. Motorists are being distracted, they're honking horns, but they're also being distracted, and we had several near collisions. So out of the abundance of caution for safety, we were forced to close roads to protect not only the motoring public, but those that would be attending this event.
Right. Thanks so much, Chief. I appreciate all your time. Thank you, Brittany. That's it for me.
Okay, great. Thank you so much, Paul. And thank you, Chief Gilbert. And again, thank you to your wonderful team for their great work this past weekend. Okay, with that draws our Tuesday briefing to a close. And we do look forward to seeing you all back here on Friday at 12 noon. So please stay safe out there and take care. And we'll see you back here on Friday. Bye-bye.
Thank you, Brittany.
Thanks.
Thanks, everyone.